Hello, hi there. My name's Ranjit Gill. I'm a GP in Edgeley and Great Moor in Stockport. I'm also the Chief Clinical Officer for Stockport CCG. That means I'm the Accountable Officer or Chief Executive of the CCG. So my job is to make sure the CCG delivers on its requirements, to make sure the population of Stockport receives excellent healthcare consistently all the time, that continually improves and delivers best practice every time. We are required to do that within tight financial constraints which we can't vary from. For us in Stockport, we have the exciting new devolution arrangements that Greater Manchester has developed with government, which means we're able to make more decisions here in Stockport with our colleagues in Greater Manchester, rather than having some of those decisions made, as was the case, from far off London. That will hopefully mean we can start to make changes faster in Stockport to both healthcare and social care, and also some of the wider issues that impact on people's health, like housing and education and employment. So it's an exciting time to be working in a CCG, and we also have to remember that actually the day-to-day work of the CCG is to help our member practices, our member GP practices, deliver the best care possible to every patient every time. So the CCG is only the sum of its member practices, and we're guided by what needs to be done, how it needs to be done, and what needs to change by our member practices and their daily experience of contact with thousands of patients. Let's not forget that 90% of people living in Stockport will be in touch with their GP practice at least once a year. That's a really rich opportunity for us as a CCG to really truly understand the needs of our population and constantly strive to deliver healthcare services that meet the needs of that population within those tight financial constraints. So within those tight financial constraints, we've decided as a CCG to work closely with Stockport Council, Stockport Foundation Trust, Pennine Care Foundation Trust, and Viaduct Health, which is a new organisation which all the GP practices in Stockport have founded to represent their interests, to work with all those organisations to deliver a new model of care built from general practice, delivering a much wider range of services led by GP practices. So this is going to include community nursing services, mental health services, social care services, aspects of preschool education, and we want to start to work with schools and with employers around helping people develop their skills to get jobs and stay in good jobs. Working with the hospital, we're also beginning to change how emergency and urgent care is provided for our public in Stockport, so that it's seamless, tightly connected together with GP services. And that means changing the way that we all access diagnostic testing, for example, and also, very importantly, working with our social care colleagues to start to get ahead of the needs of people. That means being able to predict and prevent problems rather than reacting to them, as so often the NHS has had to do in the past. This all means using a single electronic record for most services in Stockport that are based in the community, which will also help us start to begin to be able to predict problems, prevent ill health, and treat people faster and more cost effectively than we ever could before. All of this we've called Stockport Together, and our thinking has led to us being successful, being recognised nationally as a vanguard site, one of only a few in the country which is leading the way for a new form of NHS care. And all of that fits nicely with devolution in Greater Manchester, which is designed really to change some of the really terrible health outcomes in Greater Manchester. Now, we're lucky in Stockport. Actually, our health outcomes are really quite good. So we're in the top 5 in the country when it comes to survival after a diagnosis of cancer compared to the rest of the country. But across Greater Manchester, unfortunately, that's not the case. And in Greater Manchester, in contrast to Stockport, health outcomes for people who suffer cancer, heart disease, lung problems and so on are really very poor. What we want to do is help Greater Manchester start to deliver some of the excellent outcomes that people of Stockport already experience. And we want to together work to deliver a more cost-effective system of care, which means doing more in primary care, being more predictive, but at the same time, when somebody needs hospital care, making sure it's really excellent. That's why, working with other CCGs, over the last 3 years, we've developed the Healthier Together programme to reconfigure hospital services to make sure that people get excellent surgical care every time they need it. And we expect those changes alone are going to save around 300 lives a year across Greater Manchester compared to how things were done in the past. So all in all these changes we think will eventually make quite a dramatic difference to the lifespan of people in Stockport, the health outcomes for people in Greater Manchester, and move Greater Manchester from being one of the sickest places in England to one of the healthiest places in England.